Good morning, everybody. Myself, I am Ushasri, working as Assistant Professor in the B.V. Raju Institute of Technology, Narsapur, in the Department of Biomedical Engineering. The course name is Biomedical Instrumentation, and the topic which I am going to discuss is Dynamic Dental Navigation. To start with, this is the outline wherein I will be discussing the introduction, motivation for the topic, and the aim and objectives of this topic, and the materials and the methods used for this topic, and what are the various advantages for this technique. Introduction. Dynamic navigation system is a technique that allows the placement of dental implants during the implantation surgery, and it will be also helping a pre-operative planning for the surgeons by providing computer aided imaging system, which is called as CBCT, that is cone based computer tomography technique. In this methodology, it provides a real time feedback which enables the clinician to visualize the operating site dynamically and the assessment of the handpiece wherein the operation site is reached or not can be directly visualized from the screen. In other healthcare fields, wherein ability to see the skeletal structures and the internal structures becomes very difficult, and this is also in another area where dynamic dental navigation system helps to visualize the internal organs of the body. It is providing a 3D radiographic imaging of the internal surgical sites which assess the dentist to visualize the internal dental structures such as teeth, jaw and the other anatomical landmarks for the head and neck also. Motivation is to build up the dynamic dental navigation system which would be assessing the placement of the surgical site exactly and precisely with an accuracy for the proper depth, navigation and the crustal position of the handpiece. Use of static based computer tomography technique was already implemented in various dynamic surgeries and implantations. But the advantages with this would be, it would be providing less than 2 mm of crustal and apical deviation, and also provides a pre-operative planning which will be enabling the angulation error, which will be minimizing the angulation error for less than 5 degrees. Another important aspect of this dynamic dental navigation is it will be handling the post-operative complications such as damage to the adjacent vital structures during the implantation surgery, and also it will be providing a feasibility such that we can eliminate the aesthetic problems which usually the subjects don't like to have. And the implant failure, even due to lack of accuracy, can also be minimized by using this methodology. Main aim of the study is to implant the dental implants with more accuracy and precision by dynamically visualizing the operation site and calculation of the error, which in turn helps the dental surgeons to minimize the errors in the implantation surgery. Objectives is to develop a prototype which will be having a positional sensor and tracks the handpiece and the patient movements in real time, and to use a monitor that will be giving you a 3D visualization of the operation site in real time basis. And also the another objective is to aid the surgeon for corrections of this. The surgeon will be able to calculate the error, and then and there he will be able to correct the error and provide depth perception accurately. Various materials and methods used for the present technology is static dynamic navigation, as we already discussed, is already existing in the commercial usage in the clinical institutes, wherein in the static navigation system, same CBCT images will be used, which would be a two-dimensional images, and based upon these images, pre-operative planning will be done, and based upon that planning, the surgeon will be doing the implantation surgery. But the problem with this technique is real-time visualization of the operating site and any corrections in the errors which while implanting the implant, those cannot be done in static navigation system, and hence the problem persists with respect to the subjective nature of the surgeon. If he is very skilled enough wherein he is not performing any errors, then fine, the surgery will be successful and the implantation will be giving a good aesthetic look. But wherein if the surgeon is not doing it well and there are few errors in the implantation, then the implantation would result in a failure and even it disturbs the aesthetic look of the patient also. So a positional sensor which would be tracking the operating site in three-dimensional view would be giving a clear-cut idea of where the operating site is and what is the level of depth being reached to the operating site. This in turn will be monitored by the surgeon who is operating the handpiece and the tool for the implantation, and then it will be resulting in best location and implantation of the implant with more accuracy and precision. As discussed earlier, advantages of this dynamic navigation system are like they give pre-operative design perfectly and the procedure can be completed in the same day wherein the subject need not be hospitalized, and on the same day he can be discharged and he can move on. It also reduces the psychological and the ergonomic pressures on the doctors because there is clear visualization between the operation site and the reach of the surgeon to the operating site. So it relieves much of the pressure on the surgeon during the implantation surgeries, enabling high safety and predictability. It also allows the viewing and modification of the pre-operating plan in real time duration when the operation is going on live. Thank you.
Like, share and subscribe. Hit the bell icon for more updates.